Low back pain, honestly, it's one of the worst problems that affect people. It is so common and it's really debilitating. Most people, they would think that lower back pain will only come from physical causes such as poor sitting, poor posture, weak muscles, injury, lifting awkwardly, lifting very heavy things, but purely physical reasons. But actually, what's really interesting is that we can experience lower back pain at an increasing severity when we are under chronic ongoing stress. Let's delve into the reasons and the ways in which stress, something that's not physical, has a physical impact, and in a way that is really, let's discuss it in a way that really makes sense so you can actually see that it's not just something in your mind, it's something physically that's happening that causes the pain when the stress is ongoing. Let's drop into it right now. So to understand more about how stress can cause such a physical response leading to back pain, we need to understand some of the key factors about stress. So when we're under stress, there are certain physical things that your body does in response to the stress. Firstly, we need to understand stress is something that we as a society and as a structure, as a human structure, have been experiencing for hundreds and hundreds of years. It's just that the causes of the stress have changed over time. So stress back in many, many years ago, stress would have been about having shelter, having warmth, having food. And those sort of stresses are hopefully stresses that at that time were able to be overcome in a relatively short amount of time, such as food. You go hunting, you find the food, the stress is over. Nowadays, when our stress factors can be ongoing in a much more chronic or regular manner, the changes that happen in the body with the stress response, they're starting to become ongoing changes. Now, some of the key changes that happen with the stress response, that we have our blood pressure going up, we have a increase in our muscle tone and tension, we have certain hormonal changes and adrenaline release in preparation for fast activity and survival. But it's particularly to do with the muscular function in which this really can create some problems to do with your spine. So let's delve a little bit more into that right now. So when we're under ongoing stress, the body needs to be prepared to escape from a perceived threat. That's effectively the changes that are happening in the body, even in modern society, is that the stress changes make us prepared for sudden mobilization and getting out of where we are. So the big muscles of the body, they're ready for action and they are turned on, so to speak. Those muscles are ready, they are firing. But what happens is the small muscles, and particularly the small muscles in and around the spine, they do not get activated and fired up as much because all the emphasis from the brain driving control of muscular function is to the bigger muscles, the ones of our arms and our legs. So these small muscles are not actually getting triggered, and therefore the spine isn't moving quite as freely as it otherwise should. So there's a relative immobility of the spine in response to the muscular changes within the body in the stress response. So then what happens is the spine stops moving properly. When the spine stops being taken through its range of movement as effectively, the lack of movement is and has been known to cause a lot of mechanical pain within the facet joints. These joints within the spine, these little facet joints, when they're not hinging and pivoting and moving as freely and as effectively, we are much more likely to start to experience back pain. So really the pathway is we feel the stress. The muscles that are the bigger muscles get activated. The muscles that are the smaller muscles get somewhat deactivated. The overall movement of the spine decreases. When it decreases, we start to feel more pain from the facet joints within the spine through complex changes which happen at the brain level, where we actually perceive and feel everything within our life. So that's the way that stress, which is something that isn't actually physical, has a physical effect on the muscular balance and muscular systems, which can lead to lower backs and even other areas of the spine starting to go down that pathway of feeling more sore. Also, you may be someone that just suffers from lower back pain from the more physical reasons, such as you sit all day and in a poor posture. Pay attention. When your stress levels increase, when something happens and it loads another layer onto you in the stress domain, I can almost guarantee you'll start to feel more soreness where you were already feeling some soreness within the spine. And that's a way in which the stress doesn't actually cause the outright pain to commence, but it's another layer on top and adds to what's already there from probably more physical reasons, and then the layer of the emotional or psychological stress adds the extra physical dimension to the whole picture. I hope that's understandable to you, not too complicated. If you have any questions, please comment and I will answer them as best I can. I hope you're well, hope you're experiencing great health, and importantly, I hope that your health's getting better on a trajectory and that you are going to live a great year ahead. Cheers.